My name is Letitia Smith, and I am one of the mental health trainers here at BioQuest. Today, I am going to be guiding you through your training on understanding trauma. Your objectives for today are to become knowledgeable of the leading causes of trauma, to better intervene with clients experiencing trauma, to increase your knowledge of how to screen for trauma when working with clients and their families, to understand screening for adverse childhood experiences and how they impact clients with other traumatic experiences, and then lastly, to become familiar with the 3 R's of trauma and how to successfully get to a resolution or a healing. So we are going to start off today by watching a video, and this is coming from Professor Bessel van der Kolk, and he is going to give us a great explanation to what is trauma.
The most important thing to know is that there's a difference between trauma and stress. As I like to say to people, life sucks a good amount of the time. We all have jobs and situations that are really unpleasant. But the moment that the situation is over, it's over. The problem with trauma is that when it's over, your body continues to relive it. My name is Bessel van der Kolk. I'm a psychiatrist, neuroscientist, and author of the book, The Body Keeps the Score. I got interested in trauma on my first day working at the Veterans Administration. 1978 was the year, and the Vietnam War was over by about 6 or 7 years. The very first day that I met Vietnam veterans, I was just blown away. These were guys who were my age, who were clearly smart and competent and athletic, and they clearly were just a shadow of their former self. Their bodies were clearly affected by trauma, and they had a very hard time connecting with new people after the war. Around that time, a group of us started to define what trauma is, and in the definition of PTSD, we write, these people have been exposed to an extraordinary event that is outside of normal human experience. In retrospect, that shows us how ignorant and narrow-minded we were, because it turned out that this is not an unusual experience at all. People usually think about the military when they talk about trauma, but at least 1 out of 8 kids in America witness physical violence between their parents. A larger number of kids get beaten very hard by their own caregivers. A very large number of people in general, but women in particular, have sexual experiences that were clearly unwanted and that left them confused and enraged. So, unlike what we first thought, trauma is actually extremely common. There's a lot of debate of what a trauma is to this day. But basically, trauma is something that happens to you that makes you so upset that it overwhelms you. There is nothing you can do to stave off the inevitable. You basically collapse in a state of confusion, maybe rage, because you are unable to function in the face of this particular threat. But the trauma is not the event that happens, the trauma is how you respond to it. One of the largest mitigating factors against getting traumatized is who is there for you at that particular time. When, as a kid, you get bitten by a dog, it's really very scary and very nasty. But if your parents pick you up and say, "Oh, I see that you're really in bad shape, let me help you," that dog bite doesn't become a big issue because the foundation of your safety has not been destroyed. We are profoundly interdependent people. And as long as our relationships are intact, by and large, we're pretty good with trauma. It's a subjective experience, and what may be traumatic for you may not be traumatic for me, depending on our personality and our prior experiences. The problem with trauma is that it starts off with something that happens to us, but that's not where it stops, because it changes your brain. Much of the imprint of trauma is in that very primitive survival part of your brain that I like to call the cockroach brain. There's a part of you that just picks up what's dangerous and what's safe. And when you're traumatized, that little part of your brain, which is usually very quiet, continues to just send messages. I'm in danger. I'm not safe. That event itself is over, but you continue to react to things as if you're in danger. We're talking about survival. We're talking about staying alive. And so some people go into fight-flight, or on a more primitive level, people's brain shuts down and they collapse. You have these automatic responses that are not a product of your cognitive assessment, they're a product of your animal brain trying to stay alive in the face of something that part of your brain interprets as a life threat. And the problem then becomes that you are not able to engage, or to learn, or to see other people's point of view, or to coordinate your feelings with your thinking. Traumatized people have a tremendous problem experiencing pleasure and joy. But the core issue is our hormones and our physiological impulses that have to do with survival. Your body keeps mobilizing itself to fight. You have all kinds of immunological abnormalities, endocrine abnormalities, and that really devastates your physical health also. Oftentimes the physical problems are longer lasting than the mental problems. And the other thing that is terribly important is the impact of poverty, or the impact of racism, or the impact of unemployment. There's other societies that are much more trauma savvy than we are, where there is not an enormous amount of income inequality. Healthcare is universal, childcare is universal. A culture like that really looks at what are the antecedents for certain forms of pathology. So the big issue is a political issue. How do we rearrange our society to really know about trauma so that people who grow up under extreme adverse conditions can become full-fledged members of society? The sense of community and people being there for each other is a critical part of surviving and thriving.
Get smarter faster with new videos every week from the world's biggest think.
Okay, so that was an exceptional video that showed what exactly trauma is. So we're going to jump into our training and we're going to break down the concepts that were discussed. So let's start with what is trauma. So according to the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, trauma is defined as exposure to a traumatic event. A person who experiences, witnesses, or is confronted with an event or events that involve actual or threatened death, serious injury, or sexual violence, their responses are going to involve some sort of intense fear, helplessness, or horror. Some examples could include witnessing a violent death, experiencing a natural disaster, being a victim of sexual assault, being involved in a serious accident, or witnessing or experiencing extreme violence. The evolution of trauma from combat veterans to include everyday people is an important development in understanding how traumatic experiences affect individuals across different walks of life. Initially, trauma was primarily associated with combat. The term shell shock emerged during World War I to describe soldiers who exhibited symptoms like tremors, confusion, and emotional numbness after exposure to battle. After World War II, a more nuanced understanding of trauma began to develop. Vietnam veterans in the 70s and 80s, they helped to push the recognition of trauma as a mental health issue. This period saw the inclusion of PTSD in the DSM-3, which was published in 1980. That DSM-3, that legitimized trauma as a diagnosable condition. By the late 1990s and early 2000s, the definition of trauma expanded beyond war and military experiences. Psychologists and social workers began studying trauma in the context of childhood abuse, sexual violence, domestic violence, and natural disasters. The field recognized that trauma was not limited to soldiers, but could affect any individual who has been exposed to violent, dangerous, or distressing experiences. By the late 2010s, the understanding of trauma had become much more inclusive. Psychologists then began framing trauma as a universal experience, recognizing that virtually everyone is susceptible to some form of trauma in their lifetime. Now let's look at a few of the different types of trauma. There's physical, sexual, or emotional abuse. Physical abuse is actually one of the most common forms of trauma. Whether the abuse comes from a partner, a child, or another person that is close to you, it can be traumatic. Living in unstable or unsafe environments can lead to trauma impacting physical and emotional well-being. Separation from parents can be a profoundly traumatic experience for children, leading to a range of emotional, behavioral, and developmental difficulties, including anxiety, depression, and difficulties with social functioning and attachment issues. Witnessing violence or being directly involved in a violent act can be traumatizing. Childhood neglect can have lasting negative impacts on a child's development. People with serious illnesses may have a higher prevalence of trauma histories, and their experiences with healthcare in general can further be traumatizing for them. Invasive medical procedures can lead to something that is known as medical trauma. Both natural and human-made disasters can cause trauma, leading to a range of psychological reactions, including PTSD, anxiety, or even depression. Then we have severe motor vehicle accidents. Those can lead to significant physical injuries, of course, but it can also cause lasting psychological trauma, including post-traumatic stress disorder. Now, trauma is subjective and relative, meaning what one person considers traumatic, another person may not. And even the same events can have different impacts on different individuals due to factors like their past experiences and what coping mechanisms they utilize. What constitutes a traumatic event is not something that is universal. So an event that one person finds deeply distressing and overwhelming, another person might view that as a minor setback, or even they may look at it as just a learning experience. So for example, you can have two people who were in the same car accident, and you could have one person who they get right up, they walk away, they're fine, they're able to sleep at night, and they get right back up the next day and get into their car and they go to work. Whereas the second person, it could take them a while to even want to get back into a car. They may experience some sort of sleep disturbances, and they may just be reminded of the accident on a daily basis. Now, there are 5 different types of impact on trauma that we're going to get into and cover today. We're going to be looking at affective, cognitive, behavioral, physical, and psychobiological. So trauma can significantly impact a person's emotional well-being, leading to a range of negative affective responses. So right now we're looking at the affective impact, okay? So some of those negative responses could be some things like fear, anxiety, anger, guilt, shame, or even a diminished capacity for positive emotions. Trauma can trigger or even intensify negative emotions. Some individuals may experience emotional numbness or detachment, making it difficult to feel emotions, including positive emotions. Like even when they're experiencing purchasing their first home, getting married, or even the birth of their child, they're not able to experience the positive emotions that people typically would with those. Now let's get into cognitive impact. After a traumatic experience has occurred, this is when people typically start to search for answers. They need some sort of an explanation as to how something happened or why something happened. If they're not able to find those answers or there's no rationale as to what happened, that's when we begin to see irrational beliefs start to form. Traumatic experiences can affect and alter cognitions. Trauma inherently challenges the fundamental, often unconscious assumptions that people hold about the world, of how they view themselves and how they view others, which is going to disrupt the just world belief system that helps some people to navigate their daily life. So when we talk about the just world theory or belief system, that assumes that people want to believe that they live in a world where good things happen to good people and bad things only happen to bad people. For example, it would be very difficult for you to leave the house in the morning if you believe that the world was not a safe place, that all people are dangerous, or that life holds no promise. Belief that someone's efforts and intentions can protect them from bad things is going to make it less likely for an individual to perceive personal vulnerability. However, unexpected traumatic events can challenge those beliefs. Now, here are some examples of cognitive impact. Um, First, we have self blame. So, this is where a person has the tendency to attribute responsibility for a negative event or outcome to oneself. Whether the individual blames themselves for the event itself or they blame themselves for failing to foresee or prevent the event from happening. Next, we have where people they start to look at themselves as maybe being a bad person or as if they themselves are lacking in some form or another. They can start to justify what has happened, especially when what has happened is inconsistent with their beliefs or their actual values. Then experiencing betrayal by one person can lead to a generalized belief that no one is trustworthy, potentially resulting in difficulty forming healthy relationships with others. And then lastly, you see here, if someone is religious, it may lead them to modify their religious beliefs. Let's get into the behavioral impact. Now, trauma can affect basic functions, and that can lead to long-term changes in a person's behavior. These behaviors often serve as ways to cope with or maybe even to manage the overwhelming emotions and effects of the traumatic event. So, for example, we have hypervigilance and reactivity. So, this is when a person they can be in a constant state of being on alert for threats. This can lead to them easily being startled, or they could always feel tense or have difficulty concentrating on certain tasks. Then we have avoidance, where people may avoid places, they may avoid certain people that could be triggering for them, or just avoid situations in general that are going to remind them of the traumatic event that occurred. Next, we have emotional dysregulation. This is where a person is going to have difficulty managing emotions, and this can result in mood swings, frequent outbursts, or chronic feelings of anger, fear, or things of like shame. And then lastly, we see here aggression, where someone may act out through aggressive or reckless behavior. And that can actually be a defense mechanism or a way for them to express an unmet need after a traumatic event. Now, trauma can have significant physical impacts that can manifest as like headaches, muscle tension, fatigue, stomach, or even eating problems. A person could experience sleep disturbances, increased heart rate, as well as potentially leading to chronic health issues like heart disease and high blood pressure. Now, there is a connection between trauma and adverse childhood experiences, which are also called ACEs, and chronic health conditions. Now, if you're not familiar with childhood experiences, don't worry, we are going to cover those further on within this training. And then lastly, when discussing the 5 impacts of trauma, we have psychobiological impact. So the psychobiology of trauma explores the relationship between traumatic experiences and the biological changes that occur within the body and the brain. So it investigates how trauma can alter brain structure and function, and it's going to impact emotional regulation, stress responses, and overall mental health. So now we're going to watch a video on the hand model of the brain, and this is going to come from Mary Vicario, and she is going to use her hand to illustrate how brain functions and trauma can disrupt the connection between the upstairs brain, which is the prefrontal cortex for rational thinking, and the downstairs brain, which is the limbic system for emotions. So give me 1 second, let's pull this up.
Hi, I'm Mary Vicario, and it's been my joy to be a part of the Resilience Project for the last 5 years. Today, I get to talk to you about the hand brain, and I love it so much because it allows me to bring a model of the brain with me wherever I go, and I'm Italian, so I talk with my hands, so it's just a win-win all around for me. Feel free to do this with me. Between your wrist and your elbow is your spinal column and something really important called the vagus nerve. So the vagus nerve actually releases all of our feelings into every organ of our body. So literally, we feel our feelings in every organ of our body, and we don't get to decide when that happens. It just does it. So, in fact, those feelings are the feelings that frequently drive our behavior, especially if it's something we do very quickly, or if it's something that gets us in trouble, or the things that bring the people we serve to us for help often come from those feelings they get in their body, not in those thoughts that we're so proud of, but in these feelings. The next part of our brain is the brain stem. It's the palm of our hand, and it's in charge of all the things we don't think about, all the things that keep our body going that we don't think about. For example, breathing, digestion, bladder and bowel control, which means that's not under your conscious control sometimes. Arousal, the type of arousal that hopefully has you awake right now while you're watching this video, and the type of arousal that makes you want to do things far more interesting than watch this video. It's also in charge of how much information enters your brain. And if you're on the autistic spectrum or you have trauma, it actually lets in extra information because it doesn't know what you're going to need to be safe. And that extra information can become very overwhelming very quickly. In fact, it makes all your senses stronger, so things are brighter and louder and they feel weird in your mouth and your clothes feel weird and get very stressful. And the other reason it can get very stressful is that all the information that enters our brain goes immediately to our fear center, which is the next part of our hand brain, which is our thumb. The fear center, also known as the limbic system, is in charge of 3 very important things that I like to remember through the word FAR. It's in charge of felt safety, attachment, and regulation. And it likes things to happen in that order, in fact. So when the information comes into the brain, it immediately goes to the fear center and decides safe or not safe. And if it's not safe, it keeps our thinking brain offline. But if it is safe, it lets the next part of our brain, our cortexes, our thinking brain, come online and give it a hug. But when it's not safe, throws it offline. So when you're not feeling safe, it doesn't allow you to attach and work cooperatively with others. And when you can't attach and work cooperatively with others, it also doesn't allow you to regulate. And you can look like you're out of control. And it might look like a choice, but when your fear center's in charge, it's not a choice, because what it has thrown offline is your thinking brain, which wraps around the fear center and has all those wonderful thoughts and all those wonderful things we've practiced doing housed in it. But when the fear center gets afraid, throws it right offline. And the only part of our brain we have conscious control over is our thinking brain. So when our fear center throws it offline, all of those thoughts we're so proud of and that we've worked so hard on to help us control our behavior, they are out of our reach. And if the fear center can't tell, should I be afraid or not afraid, it always errs on the side of fear to keep you alive. So we want to find a way to get a message from the thinking brain to the fear center so they can work together when we're afraid. And we're going to look at how to do that. So our vagus nerve and our brainstem think in sensations and feelings. Our fear center, our limbic system, thinks in feelings and pictures. And our thinking brain thinks in pictures and words. So you may have guessed it, the passport from the fear center to the thinking brain are the pictures. When we can create a picture for what we want, we have a better chance of getting a message to that thinking brain, bringing it back online so it can hug our fear center and help us feel safe again.
All right. So, as we saw, the hand-brain model helps explain how traumatic experiences can lead to dysregulation, where the downstairs brain becomes dominant and the individual struggles to access their rational thinking and emotional regulation abilities. So, let's look at the end results of trauma, and let's discuss what can happen as a cause of trauma. So some clients with trauma histories can respond to their past trauma in the present, sometimes struggling to discern that the context has now changed, leading to reactions that may seem disproportionate or out of place. For example, a person who experienced a loss might become overwhelmed by sadness or anxiety in situations that remind them of the loss, even if the current situation is completely different. Some people may even start to blend multiple traumatic experiences together. Some people's responses or coping mechanisms can be described as defensive or even as being self-protective, as they are going to use or they are used to avoiding uncomfortable emotions or situations. They can react in a way that shields them from perceived threats or criticism. Essentially, it's a way in which the brain protects itself from any type of perceived harm. We can also start to see maladaptive behaviors form after some sort of traumatic event. Maladaptive behaviors are behaviors that stop a person from adapting to new or difficult circumstances. They can start to form after a major life change, illness, or traumatic event. Trauma can also lead to a wide array of emotional, physiological, and physical consequences, including but not limited to having unstable or poor peer relationships, lack of trust in others, difficulty concentrating, lack of self-control, educational delays, lack of confidence in oneself, opposition to authority, loss of meaningful relationships, or even a lack of unrealistic long-term goals. Now, Maslow's hierarchy of needs, this outlines human motivation, and it starts from the basic physiological needs all the way up to self-actualization needs. And this can be a helpful framework for understanding how trauma impacts individuals. Trauma can disrupt the ability to meet even basic needs, which can potentially hinder the progress of the hierarchy. So this hierarchy of needs, it starts again with the basic physiological needs like food, water, shelter, things like that. And then it's going to progress to safety, and then love and belonging, then esteem, and then finally self-actualization. So with trauma, it's often necessary to address the lower levels of the hierarchy first before moving on to the higher level needs. Now let's become familiar with the 3 R's of trauma and how to successfully get to a resolution or healing. And we're going to watch a short video again from Miss Mary Vicario, as she is going to discuss the 3 R's of trauma.
So now I get to talk with you about the 3 R's of successful trauma resolution. The first R is re-experiencing. The second R is releasing. And the third R is reorganizing. But before we get onto the path of the 3 R's of successful trauma resolution, we have to look at where we meet the people we serve, because they're not on the path yet. They're still caught in yet another R called reenactment. And the important part of that word is the act. It is the reenactment that causes the acting out behaviors, as they're often labeled, that bring people to our door. And what their brain literally is doing is reliving the trauma in the present moment without their thinking brain knowing it. And this reenactment is not a choice. It comes from the part of the brain we don't have conscious control over. And it feels like the trauma is happening all over again. It's a very lonely, frightening place to be. And when they're done, it may look like they have gotten some relief, but they have not. That person is caught in the trauma of the past and reliving it in the present moment. They don't feel safe. They are just as frightened now as they were when the trauma happened. And it's not a choice. It's not a relief. And it's something we actually can help them move beyond. Where the 3 R's of trauma resolution comes in is that the first one, re-experiencing, can happen depending on how we react to someone's reenactment. If we reflect the fear that we see and we honor that they had the courage to show us that fear, and we connect them with the fact that they're safe and in the here and now right now, we literally allow that person to re-experience that trauma, not from a place of being alone, but from a place of connection. So when you get to re-experience that trauma with a safe other, whether it's through drawing or writing, the person no longer feels alone in that moment. And it literally takes them off their hamster wheel of reenactment. You have helped heal their brain. So the second R is when we honor what they've done to survive, and that allows their brain to release their trauma from the central nervous system and put it in the memory center of the brain where it belongs. We are helping their brain release their trauma, and we're also giving them dignity for the survival they have already done that has gone unrecognized. And then the third R is my favorite, because once you've released it, you are aware that the trauma has happened, but it is no longer the central organizing feature of your life. Then all the energy your brain was taking up, keeping you in the past and looking out for the future and not allowing you to live in your present moment, is freed up for you to decide what you want for your present and your future. You literally now can connect with people, feel safe enough to reorganize your life around what you want your life to be.
All right. So some key takeaways are, depending on how we respond to someone's reenactment, a person can either re-experience or process their trauma in a realistic way. So giving someone the space without judgment to feel pain, loss, or any emotion that connects to the detailed memory of the event. So when we honor what a person has done to survive, we allow their brain to release the trauma from the central nervous system and put it in the memory center of the brain where it belongs, okay? Excuse me, a person can actually live without feeling compelled to relive or repeat a traumatic event, either consciously or unconsciously. So once the trauma is released, a person will be aware that the trauma has happened in the past, but it's no longer experienced or seen as a clear and reoccurring danger in the present. Now, here's some keys to providing trauma-informed care. We need to assume that clients have experienced trauma in some form or another throughout the span of their life. Be mindful of your wording when you're speaking to people. You should make sure that you're asking what has happened to you versus saying what's wrong with you, right? So, saying what's happened to you is generally a more empathetic question, and it's a better, helpful approach because it's going to focus on understanding the person's experiences rather than immediately judging or labeling them. Understanding the vulnerabilities and triggers of trauma survivors is going to be crucial for providing supportive care and preventing re-traumatization, which is a core principle of trauma-informed care. So by recognizing these factors, providers can create safer environments and tailor interventions to the specific individual's needs. Trauma-informed care is going to recognize that survivors need to be respected, informed, connected, and hopeful regarding their recovery. They need to see some sort of hope there. This is going to emphasize a collaborative approach, and it focuses on the individual's strengths rather than their deficits. You also need to understand that there's a strong correlation between experiencing trauma and the development of various symptoms like depression and anxiety, or even substance use or eating disorders, because those can be short-term or even long-term symptoms. Trauma-informed care, that is going to prioritize creating a calm and nurturing environment by understanding the impact of trauma and ensuring safety and fostering trust through consistent practices and responsive relationships. So be conscious of a person's demeanor, okay? So when you're talking to people, just take into account, like if they're moving from a calm state to a state of emergency, you as the clinician or the caregiver, you're going to want to model care and compassion, and you want to adjust in the moment. If you can adjust things in the environment to make it a more calm and nurturing environment, then that is what you're going to want to do in that moment. And then lastly, you want to be aware of the language that you're using. So certain words or phrases can inadvertently trigger traumatic memories or emotions, which can cause distress, and it can hinder a person's recovery. So you want to use language that is clear, honest, and respectful. You want to focus on the individual's identity and their humanity rather than their trauma or condition. So to further explain that, I'm just going to use the example of instead of saying, oh, I'm working with a traumatized child, you could say, I'm working with a child who has experienced trauma. Now let's look at adverse childhood experiences, or ACEs, and how they are related to trauma. So ACEs are defined as potentially traumatic events that occur in childhood. ACEs can include violence, abuse, and growing up in a family with mental health or substance use problems. So these experiences, particularly when severe, frequent, or prolonged, these can trigger a toxic stress response in children. So toxic stress stemming from adverse childhood experiences, that can significantly alter brain development and impact the body's stress response, which could potentially lead to long-term health or even behavioral problems. So the last video we're going to watch today is going to give us an overview as to what adverse childhood experiences are.
A child's experiences early in life are important building blocks for the developing brain. Genes, nature, are like the blueprint. They provide the basic framework for brain development. However, genes do not design the brain completely. Environmental influences, nurture, fine-tune how the brain works by shaping which brain connections get used. Connections that are used more grow stronger and more permanent, whereas ones that do not get much use fade away. Together, genes and the environment build the foundation for all future development. Safe, stable, and nurturing relationships early in life lead to healthy development. But children's brains capture other experiences as well. stressful events. However, not all stress is bad. Positive stress involves normal childhood experiences, like starting daycare or meeting a new person for the first time. This stress is essential for healthy development because it helps children develop coping skills and confidence. But when stress is frequent, chronic, and uncontrolled, it is toxic to children, especially when they do not have a caregiver to provide support or buffer the stress. Adverse childhood experiences, ACEs, such as abuse, neglect, exposure to intimate partner violence, parental depression or addiction, and poverty, are toxic stressors which could lead to lifelong changes in learning and behavior. ACEs early in development can impact social, emotional, and cognitive functioning, increased risk-taking behavior such as drinking and substance use, and increased risk of disease, disability, and social problems later in life. The question is, how do adverse childhood experiences impact a lifelong development? One of the most important systems in our body is our stress system. It's activated when we experience stress. We become alert, our heart rate increases, and so do our stress hormone levels, cortisol and adrenaline. Our body is ready to react, what is known as fight or flight. A short period of time after the stress is over, or if a child receives support from a caregiver, the stress response turns off and the body returns to a normal state. Adverse childhood experiences create stress responses that stay active, and without the support of a caregiver, the system has difficulty shutting off completely. This constant and prolonged activation can affect immune system functioning and increase the chances of sickness, infection, and disease. Prolonged activation of stress hormones is also toxic to the brain. Certain areas of the brain are more vulnerable to toxic stress, including the executive center or the brain's control center, an area important for solving complex problems, attention, reasoning, impulsivity, inhibition, and learning. A second area is the emotional center, the brain's alarm system, which is involved in processing and interpreting emotions and the ability to control impulses. The third area is the memory and learning center, the brain's filing cabinet, which plays a major role in learning and the formation and retrieval of memories. Science shows that adverse childhood experiences impact all of these brain centers. Behaviorally, what we begin to see is emotional distress, poor emotion regulation, greater impulsivity, learning difficulties, and physical and mental health problems. More recently, science has begun to look at how ACEs cause changes in gene expression through a process called epigenetics, which helps us understand how nature and nurture interact. Epigenetics causes changes in the way genes work without changing the DNA code itself. This occurs through chemical changes influencing how the code is used. In other words, genes are like the hardware in a computer. They determine the boundaries of what is possible. However, we need an operating system to tell the hardware what to do. Epigenetics is like the operating system directing the function of a gene's DNA hardware. The genes we are born with are the genes that we have for life, but experiences like nutrition, exercise, smoking, stressors, and relationships all affect our biology. Adverse childhood experiences are associated with epigenetic changes related to stress, brain development, cognition, and systems associated with mental and physical health. Changes that happen early in brain development are more likely to be enduring and are possibly passed on to future generations as well. The good news is that positive, supportive relationships at any stage in life can make a difference. However, supporting families and children early on will help prevent many of these negative outcomes. One of the key ingredients for healthy development is having warm, loving, and actively engaged caregivers. This involves promoting serve and return interactions, where caregivers actively and warmly engage with the child, making eye contact, responding to sounds, words, gestures, emotional needs, and sharing experiences like reading and play. Providing programs that support caregivers to strengthen these abilities are the blocks that build healthy foundations for life.
Okay, So let's look at and discuss what tools we can use to determine if a person has experienced adverse childhood experiences. So here you see the ACE questionnaire. This is a tool that is used to assess and measure a person's exposure to potentially traumatic events or stressful situations during childhood. It's going to help to identify potential risks for future health and well-being. The ACE questionnaire is often referred to as the ACE 10, but it is a 10-question survey that is going to explore a person's experiences with abuse, neglect, and household dysfunction. Now, trauma, particularly during childhood, has a striking and well-documented association with physical and mental health problems, including chronic diseases, substance use, and mental illnesses like depression and PTSD. The seminal ACE study conducted by the CDC and Kaiser Permanente that demonstrates a strong relationship between ACEs and increased odds of developing various health and mental health conditions into adulthood. So with ACEs, those are also strongly correlated with a range of negative health outcomes in adulthood. So people who have experienced 4 or more categories of ACEs have 2 times the rate of lung and liver disease, 3 times the rate of depression, approximately 3 times the rate of alcoholism, 11 times the rate of intravenous drug use, and 14 times the rate of attempted suicide, meaning the greater number of developmental traumas experienced in childhood, that's going to increase the odds that in adulthood, a person can experience illnesses or engage in high-risk health behaviors. So when it comes to, let's look at collecting trauma history, okay? Now, when it comes to collecting trauma history, this can be a sensitive process where you're going in and you are obtaining information about past traumatic events and their impact on your patients or your clients. So due to the subject matter, this can be an overwhelming process for those that don't have healthy coping mechanisms in place. So instead of focusing on the details of past trauma, you want to screen for the impacts of trauma, such as anxiety, depression, substance use, and chronic pain by looking for the markers of trauma. We're going to talk a little bit more about the markers of trauma on the next slide, okay? But this can be a more sensitive and effective approach to identifying and addressing potential trauma-related issues. So you want to inquire about trauma using open-ended questions. So you want to start with very typical general non-leading questions about experiences and feelings, and you want to allow individuals to share at their own pace, whatever their comfort level is. You want to make sure you are avoiding using specific or accusatory language. You want to use a structured tool to explore past trauma, like the adverse childhood experience questionnaire that we just looked at. Now let's look at these trauma markers, or the markers of trauma, okay? Now, trauma markers are signs and symptoms that can indicate a person has experienced trauma, including changes in behavioral, physical reactions, and emotional distress. So for clients who have a mental illness, or they are suffering from substance abuse, or have obesity and diabetes, there is a very good chance that they have a serious traumatic experience at some point in their lifetime. Now let's look at your approach, okay, as the caregiver. So when it comes to your approach in working with individuals, you want to use what we like to call a trauma lens, okay? So with using a trauma lens, you want to assume that a client's trauma may have contributed to their current medical conditions. You also want to use a trauma-informed approach. So integrating a trauma-informed approach into healthcare alongside traditional medical therapies, that can lead to better patient outcomes and experiences by recognizing the impact of trauma and creating a safe and supportive environment for healing. And behaviors, we have to realize that behaviors often attribute to personality disorders like borderline personality disorder. That can also be a significant symptom of trauma or PTSD, including emotional dysregulation, unstable relationships, and self-destructive behaviors. So these two can also be considered markers and can include being reactive, easily triggered, easily offended or angered, or even withdrawn. Vicarious trauma. So it's important to acknowledge that many providers and staff themselves have some sort of history of trauma, okay? Now, vicarious trauma is also known as secondhand trauma or insidious trauma, but this is a form of trauma that occurs when individuals are exposed to traumatic events or experiences indirectly through maybe hearing different stories or experiences that other people have gone through when they haven't actually experienced the trauma directly themselves. So this is actually a form of empathy-based stress, and it can lead to emotional, psychological, and sometimes physical distress. So with vicarious trauma, it is a significant concern for professionals who regularly work with individuals who have experienced trauma or they are trauma survivors. Okay, so we must be aware that working with patients with severe illnesses and significant histories of trauma that can cause vicarious trauma. So being conscious and being aware of our own traumas is going to help us maintain a professional and therapeutic stance towards clients with trauma. So when we use guidelines for inquiring about trauma and past trauma, it's known to be less triggering or dangerous for our patients, and it's also less overwhelming for us as providers. You want to make sure you are taking care of yourself, okay? So by taking care of yourself, you want to make sure that you are engaging in self-care, okay? So engage in some sort of relaxing and self-soothing activity. You want to maintain a healthy work-life balance, and you want to prioritize physical and mental well-being. You want to seek support when you can, okay? Connect with your colleagues, get close with your family, your friends, and lean on them for support. Or you can also seek professional help through therapy or even some sort of support group. And then lastly, you want to look into your organizational support, okay? Because different organizations, they can implement strategies such as implementing regular supervision. They could offer peer support and different types of training to address vicarious trauma in the workplace. Remember, if someone is sharing their traumatic experience with you, all you have to do is listen to them and thank them for sharing with you. Thank them for trusting you to even share that information. That's all you have to do, okay? And that concludes your training for today. I am going to allow you guys to take screenshots of some additional resources that you can look at on your own to provide some additional education for you. And then lastly, please just take a moment to take our survey. Let us know how we did. Give your feedback on this training so that we can improve moving forward. Thank you for your time and your attention. Again, my name is Letitia Smith, and this has been your training on understanding trauma.